My name is Mulan Nguyen, and I'm a nursing student here at the College of Nursing, and today I will be performing a medication administration checkoff. This is my ID, and I'm gonna turn the table. Okay, so all right. So I have my MAR form here and my patient chart. I'm going to be checking for the right medication order. So I have, in order for Novolin-R regular insulin, and I'm going to be checking the 7 rights. So right medication, Novolin-R regular insulin, 10 units. The right dose is 10 units. The right route is subcutaneously on that MAR. The right time, 30 minutes before meals. It's currently 30 minutes before lunch right now. And the right patient, I have a Jaguar J. Jones, date of birth 8/25/1963, date of birth 8/25/1963, medical record number 4176352, and medical record number 4176352. The right documentation will be done after the medication is administered, and the right indication is insulin for diabetes for the patient. I'm also going to check for allergies, which says penicillin on the MAR and allergic to penicillin on the patient chart. So after that, I'm going to perform hand hygiene, and I'm going to pick out the right medication, which is Novolin-R. I'm checking the expiration date, which is 12/1/2025, 0800. So, Novolin-R. And the right dose is 10 units. The right route is subcutaneously, and I have my 1/2 milliliter insulin safety syringe right here, and the right time, which is 30 minutes before meals, and it's 30 minutes before lunch right now. So I'm going to prepare my medication, get my alcohol prep pad, and I'm going to be wiping the top of my vial, and I'm doing circular motions outwards like that. And I'm going to be getting my syringe out. I still have to be sterile later. So take the cap off. Now I'm going to draw out 10 units of air. Okay. So I have my 10 units right there. And I'm going to put into the vial and inject the air into the vial. Turn it over, hold it steady, and I'm gonna draw out 10 units of insulin, making sure there's no air bubbles, and if they are, just give it a good flick. All right, so I'm gonna double check my dose, the right dose, and it's 10 units, and I have 10 units here. So that's my 10 units of insulin in the syringe. Okay, so I am going to be doing the scooping method to put my cap back on, and I'm going to prepare a label with some tape. And on the label, I'm going to write the drug name, so Novolin R, the right dose, 10 units, and the patient's name, Jaguar Jones. So I'm just gonna show the label, and I'm gonna put on my syringe. So, and I'm going to ask a different nurse to verify for me, because this is insulin. So they're gonna verify the right dose, looking at the MAR in my syringe, making sure it's correct, and she said it's correct. So now, with my vial, my syringe, and my MAR, I'm going to do the 7 rights again. So, starting with the right medication, Novolin R regular insulin, the right dose, 10 units, the right route, subcutaneously, the right time, 30 minutes before meals. It's 30 minutes before lunchtime right now. The right patient, Jaguar J. Jones, Jaguar J. Jones. Date of birth, 08/25/1963, 08/25/1963. Medical record number 417-6352, medical record number 417-6352. And the right documentation will be done after the medicine is administered, and the right indication is diabetes. So now I'm going to take my vial, syringe, and MAR, and I'm going to go into my patient's room. Hi, Mr. Jones. Let me move this chair. All right, so I'm going to perform hand hygiene, and I'm going to be looking at my patient's wristband on his arm, and I have to verify his identification, Jaguar J. Jones, Jaguar J. Jones, date of birth 08/25/1963, 08/25/1963, medical record number 417-6352, medical record number 417-6352. All right, and Mr. Jones, I see that you have an allergy to penicillin here. Do you have any other allergies? No? Okay, so your wristband is correct. And I'm gonna do the third verification and final one now at the bedside table. So I'm gonna check for the right medication, Novolin R regular insulin, the right dose, 10 units, the right route, subcutaneously, the right time, 30 minutes before meals, the right patient, Jaguar Jones, 08/25/1963, medical record number 417-6352, the right documentation will be done after the medicine's administered, and the right indication is diabetes. So now I'm going to raise the bed up to a comfortable working height. I'm going to move the guardrail down, and I'm going to say, Mr. Jones, I'm going to administer your insulin now, okay? And I'm putting on my goggles, like that, and my clean gloves. And I'm going to have my injection site, which is going to be on the abdomen. And I'm looking for the integrity of the muscle, which looks good, and I don't see any bruising on the skin. So now I'm going to disinfect, circular motions moving outwards. All right, Mr. Jones, are you ready? I'm going to pinch 2 inches of the skin, and I'm going to be going in at a 45-degree angle. All right. And let me get a pad for you. And I'm immediately disposing my needle and syringe into the sharps container. All right. I am now going to move the bed up. I'm going to move the bed down, all the way down. And I'm going to lift the guardrail up. And I'm going to take off my gloves, third way, take off my goggles. And I'm going to perform hand hygiene once again. And I'm going to assess the injection site for any allergic reactions, which I do not see any. And now I'm going to be doing the right documentation on the MAR form. So I would write everything I just did, have the 7 rights, the right medication, the right dose, the right route, the right time, the right patient, the right documentation, and the right indication. Now I would also write how I assessed the patient after his injection to see how he felt, and he was fine after the injection, no signs of any implications. So that concludes my medication administration checkoff.